With so much uncertainty in our daily lives, it seems like a lot of us are feeling anxious these days.
Yeah, but how do we know when just a little bit of worry and fear is something more problematic? And what can we do to deal with a more serious anxiety? Joining us now on Skype to answer some of these questions is our relationship guru, Dr. Shonda Craft. Dr. Craft, thanks so much for being with us today.
Good morning.
Can we just start with that very first question? How do we know the difference between just that little bit of worry and if you do have an anxiety disorder?
Yeah, so that's a really good question. So people throw around the term anxiety and anxious quite a bit, and we know that it is common for people to have occasional worry and fear. That's pretty typical for us. So, thinking about job interviews or your first day of school or meeting the in-laws even, there's that little bit of a butterflies in your stomach kind of a feel, I guess I would call it. But when we start seeing that our worry and our fear is much more prolonged and it's really impacting a lot of different areas of our life, that's when you might actually have more of a disordered anxiety, such as generalized anxiety disorder.
So how do we deal with it? If on either side of this, whether you have a disorder or whether you have maybe more of the generalized anxiety that people should perhaps understand is a normal thing to have in your life.
Yeah, well, I think the first thing, Jason, really is to think about, recognizing the symptoms. And so if you're feeling overly restless, if you're feeling like you can't really sleep well because your mind is just separating on all of the worry, all of the fear, difficulty concentrating, it really is important for people to seek out some help and talk to someone about, what they're experiencing, especially, again, if it feels really out of the ordinary.
And that person can help you with, in some cases it could be medication, in other cases it could just be some techniques that you could work on to help manage your stress.
Absolutely. Psychotherapy and medication, there are anxiety medications and even some antidepressant medications that are helpful. But really thinking about things like stress management and stress reduction are also important. So deep breathing, that whole idea of counting to 10 when you're feeling really anxious coming on, doing some meditation is important. Getting your body moving around is also important. One of the things that I tell my clients also is that if you're having difficulty falling asleep because your mind is just kind of racing, keeping a notebook or a journal right by your bed, or, giving yourself a little voice message on your phone to kind of get those thoughts out of your head so that you can settle down to reduce that stress.
Dr. Craft, I think one of the most challenging aspects of this is if you are someone who doesn't experience anxiety and someone in your circle is experiencing it, that you feel like you don't know what to say and anything you say is not helpful. Any advice for those friends who are trying to help out their family or friends or coworkers?
Well, first of all, just acknowledging that what they're feeling is real. We all have different barometers of stress and anxiety and how much we can handle. And so sometimes saying things like don't sweat the small stuff or don't worry about it actually can feel pretty stigmatizing to people and kind of minimizing of their problems. So really affirming that the worry and the fear is real for them and figuring out how can you be supportive without getting pulled into the panic or the anxiety yourself is really important. And I think really encouraging people to seek their own help and participate in that if you can. If you're a partner or a parent, going along for a therapy appointment or a discussion with the doctor is really important. But especially right now in these times where everything is uncertain, saying everything is going to be okay might not be helpful, especially when we don't really know when things are going to be okay again.
Mm-hmm.
Right.
We've talked about the stigma of mental illness, but these anxiety disorders are actually quite common. I mean, upwards of 15 or 20% of the population?
Yeah, definitely. And we are seeing that increasing, obviously, with everything going on with COVID and some of the, racial unrest pieces. And, everybody is just a little bit on edge. So it is really important to be able to, again, check out yourself. And if things feel a bit off, make sure that you're talking to people and not isolating.
Good advice. Dr. Shonda Craft, thanks for joining us. We appreciate it.
Thank you.